So today I'm going to be giving a patient, Marjorie Lemon, intramuscular injections, and she's a patient that has recently had a cesarean section, and she has a baby that's in the NICU right now, so I'm going to also play that into my assessment. So what I'm going to do first is I'm going to check the doctor's orders, and I see in the doctor's orders that she has morphine 5 to 10 milligrams IM Q4H, and she also has gravel 25 to 50 milligrams IM or PO Q4H, and I'm checking that against the MAR, and it's the same, so I can put my signature there. So now I'm going to wash my hands, and other things that I'm going to do is I'm also going to see if they have any contraindications against each other, because if I wanted to give them together, like if they were incompatible, then that wouldn't be very good. And another thing that I'm going to do is see if they can both go in the same syringe, because the gravel is intramuscular or PO, so I have the choice to give it either way. But if I'm already giving an IM injection, then I'll give them both IM. So now I'm going to wash my hands and go introduce myself to the patient. I'm also going to provide privacy. Hi Marjorie, my name is Brittany, I'm the student nurse. I just want to come in and see how you're doing. How are you doing, Marjorie?
Oh, I'm doing good, thanks. As good as I could do.
As good as you could do. Do you have any pain right now?
Yeah, I do have quite a bit of pain in my incision site.
How much can I scale 1 to 10?
I would say about 6.
About 6? Oh, that's creeping up there. What about any nausea? The other nurse told me that you've been vomiting a lot.
Yeah, I've been throwing up a lot today. It hasn't been that much fun.
Yeah, that doesn't sound like fun at all. Do you find you get more nauseous when you move, or like?
Yeah, with movement, my nausea definitely increases, yeah.
Oh, okay. So, I saw in your orders that you can have morphine and gravel, and I was wondering if you have like any adverse reactions to that, or any allergies or anything like that?
No, I have had both of those before, and I find that they feel fine in my body and that they work pretty well.
All right. Yeah, and I'm gonna be giving them IM, like through an injection. Have you had an injection before?
Yeah, I've had quite a few injections, especially with this recent few days.
Yeah, and how'd you tolerate those?
Not too bad, better than I expected.
All right, so I'm just gonna look at your incision site right now.
Okay.
That's all right?
Yep.
So I'm looking at her incision site, and it looks all right. Like the dressing is dry and intact, and there's not anything that would make me concerned. And I'm also going to have a peek at the injection site. I want to give it in your hip. So I'm going to look there, and what I'm looking for is like see the quality of the muscle, if there's any atrophy, any discoloration, any redness, bruising, and it looks good. So I know that I can go ahead and give that intramuscular. I'm also going to check her wristband and double check that she doesn't have any allergies written on there, even though she verbally told me. All right, Marjorie, so just hang in there, and I'll be back as soon as I can with your medication. So now I'm going back to the med room, and I'm going to take my MAR here. And so I have my MAR and my med book. So I'm going to gather all the stuff that I need. So I have a 3 ml syringe. I've got a blunt needle. I have another needle that I can give the injection with. It's a 22 gauge, 1.5 inch. And then I've got the medications. So I have the gravel, 50 milligrams per mil, and the morphine. And I'm just going to check the expiry date and make sure that they're not expired. And both of them are not. And then I've got a drug label that I'm going to use to label my needle, and some alcohol swabs. So I'm going to go ahead and, hold on, I need a pen. I'm gonna go ahead and make the label first. And I'm just labeling it with the drug and the dose, and the name of the patient that it goes to. Also, I decided to give Marjorie 5 milligrams of morphine instead of 10 because I don't want her to be drowsy. But I also think that 5 milligrams of morphine will be able to take the edge off her pain and maybe provide her with some comfort. So I'll follow up and assess and see if she needs more later. And then I'm also going to give 50 milligrams of the gravel because she is quite nauseous and I want it to have a really quick effect. So I'm going to go ahead and start drawing up my medications. Swab the top of my multi-use vial, and it's the gravel, 50 milligrams per mil, so I'm going to inject 1 mil of air into the vial and then draw up 1 mil. So I had 1 mil there. Just going to recap that. And break my ampule safely. And I also need the full 1 mil that's in the ampule to get my 5 milligrams of morphine. And now I'm just going to change the needle. And label it. And discard this safely in push-ups. Alright, so now I'm ready to go in to give my injection to Marjorie. And I'm also going to need a pair of gloves. So I'm going to take my marker with me. Get all set up over here. Hi Marjorie, you still doing alright?
Yep, I'm hanging in there.
Oh, good to hear. Alright, so I'm going to need you to verbally tell me your name and your birthday.
Marjorie Lemon, birthday August 3rd, 1982.
Alright, sounds good. And that matches up on the MAR as well. So I'm just going to get you to move onto your side, and my lovely friend Lisa is going to help me move you over so you don't hurt your stomach as well. So do you mind passing me the pillow? I'll get you to hug this and move you on your side. And I'm just going to get you to move your hips this way a little bit. Alright, so I'm looking at the site again. I'm going to put on my gloves. And so I'm just going to do the landmark, and I'm feeling for the greater trochanter of her leg, and then I'm feeling the iliac crest here and the anterior and superior iliac spine. So right here, this area is where I need to go, and I'm feeling for the quality of the muscle, make sure there's no atrophy, and also, yeah, that the site looks like it will manage an intramuscular injection. So now I'm going to clean the site with my landmarking. So I've already done all of that there. I'm going to clean the site here in one circle. And leave this pointing at the site so I can go back. And then I'm moving my cap. Move the needle. So do my landmarking again, make sure it's right in the right area there that I've already cleaned, so I wouldn't touch it again. And now I'm going to do my Z tracking, so I pull down the skin and do my darting motion. And hold it there and aspirate, make sure I'm not in a blood vessel. And it's clear, so I'm going to go ahead and inject 1 ml every 10 seconds. How's that feeling? Is there any stinging or burning?
Oh, it's feeling okay.
Alright. And after it's fully injected, I'm going to wait for